Hydroxyzine Pamoate, a prescription antihistamine, is commonly prescribed to manage anxiety and itching caused by various conditions, such as allergies, dermatitis, and eczema. This medication works by blocking histamine receptors in the body, which helps to reduce symptoms such as itching, hives, and anxiety. Understanding the typical uses of hydroxyzine pamoate. Hydroxyzine pamoate is primarily used to treat anxiety disorders and relieve itching caused by allergic reactions or skin conditions. It is often prescribed for individuals who may experience anxiety as a result of their allergic reactions or those who struggle with chronic itching due to skin conditions such as dermatitis or eczema. In terms of anxiety disorders, hydroxyzine pamoate can be particularly effective in managing generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. It is sometimes used as an alternative treatment for individuals who cannot tolerate or do not respond well to other anxiety medications. In addition to its anti-anxiety and anti-itch properties, hydroxyzine pamoate can also have sedative effects, making it useful for individuals who may experience difficulty sleeping due to their symptoms. This medication can help promote a sense of calmness and relaxation, allowing individuals to manage their anxiety or itching more effectively. Recommended dosage for hydroxyzine pamoate. The recommended dosage for hydroxyzine pamoate can vary depending on the individual and the severity of the symptoms being treated. It is important to follow the instructions provided by your healthcare provider and to never exceed the prescribed dosage. Typically, the initial recommended dosage for anxiety treatment is 50,100 mg taken by mouth every 6 to 8 hours, as needed. For itching caused by allergic reactions or skin conditions, the initial recommended dosage is 25 mg taken by mouth 3 to 4 times daily. It is important to note that individual response to hydroxyzine pamoate can vary, so your healthcare provider may adjust the dosage based on your specific needs. It is also recommended to start with a lower dosage and gradually increase it if necessary, to minimize the risk of potential side effects. Potential side effects of hydroxyzine pamoate. While hydroxyzine pamoate is generally well tolerated, like any medication, it can cause side effects. Common side effects of hydroxyzine pamoate include drowsiness, dry mouth, blurred vision, and dizziness. These side effects are typically mild and may diminish over time as your body adjusts to the medication. In some cases, more serious side effects may occur, although these are rare. These can include severe drowsiness, difficulty breathing, irregular heartbeat, or allergic reactions such as rash, itching, or swelling. If you experience any of these symptoms, it is important to seek medical attention immediately. It is also important to be aware that hydroxyzine pamoate can interact with other medications, so it is crucial to inform your healthcare provider of all the medications you are currently taking to avoid any potential adverse reactions. User experiences with hydroxyzine pamoate. User experiences with hydroxyzine pamoate can vary, as each individual may respond differently to the medication. However, many users report positive results in managing their anxiety or itching symptoms. Some individuals who have used hydroxyzine pamoate for anxiety have found it to be effective in reducing their symptoms and promoting a sense of calmness. Users have reported feeling less anxious and more able to cope with daily stressors. However, it is important to note that individual responses may vary, and what works for one person may not work for another. For those using hydroxyzine pamoate for itching caused by allergic reactions or skin conditions, users have reported relief from their symptoms, including reduced itching and improved skin condition. This medication has been praised for its ability to provide relief from itching that may be interfering with daily life and sleep. Hydroxyzine pamoate versus other medications. Hydroxyzine pamoate is one of several medications used to treat anxiety and itching. It is often compared to other antihistamines and anti-anxiety medications to determine the best course of treatment for individual patients. Compared to other antihistamines, hydroxyzine pamoate has been found to be more effective in managing anxiety symptoms due to its sedative properties. It can provide a greater sense of calmness and relaxation, making it a preferred choice for individuals who experience anxiety alongside their allergic reactions or skin conditions. In terms of side effects, hydroxyzine pamoate may cause more sedation and drowsiness compared to other antihistamines. This can be beneficial for individuals who also struggle with insomnia or difficulty sleeping due to their symptoms. However, it is important to weigh the potential benefits against the potential side effects and to consult with your healthcare provider to determine the most suitable medication for your specific needs. Precautions and contraindications for using hydroxyzine pamoate. While hydroxyzine pamoate is generally safe and well tolerated, there are certain precautions and contraindications to be aware of before starting this medication. It is important to inform your healthcare provider of any medical conditions you have, as well as any medications or supplements you are currently taking. Hydroxyzine Pamoate should be used with caution in individuals with liver or kidney disease, as these conditions can affect how the medication is metabolized in the body. Additionally, individuals with a history of heart disease, glaucoma, or urinary retention may need to avoid or use hydroxyzine pamoate with caution, as it can exacerbate these conditions. It is also important to note that hydroxyzine pamoate can interact with certain medications, including sedatives, tranquilizers, and anticholinergic drugs. These interactions can increase the risk of side effects or decrease the effectiveness of the medication. Therefore, it is crucial to discuss all current medications with your healthcare provider to ensure safe and effective use of hydroxyzine pamoate. Tips for taking hydroxyzine pamoate effectively. To maximize the effectiveness of hydroxyzine pamoate and minimize the risk of potential side effects, it is important to follow these tips. Take the medication as directed by your healthcare provider. Do not exceed the recommended dosage or change the frequency of use without consulting your healthcare provider. Take hydroxyzine pamoate with food to help reduce the risk of stomach upset. Avoid consuming alcohol while taking this medication, as it can increase the sedative effects and impair your coordination and judgment. Be cautious when engaging in activities that require mental alertness, such as driving or operating heavy machinery, as hydroxyzine pamoate can cause drowsiness and impair your ability to concentrate. If you miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. By following these tips, you can ensure safe and effective use of hydroxyzine pamoate. Frequently asked questions about hydroxyzine pamoate. Is hydroxyzine pamoate addictive? Hydroxyzine pamoate is not considered addictive. However, it is important to follow the prescribed dosage and not exceed the recommended use to avoid potential dependence or abuse. Can I take hydroxyzine pamoate during pregnancy or while breastfeeding? It is important to consult with your healthcare provider before taking hydroxyzine pamoate during pregnancy or while breastfeeding. While it is generally considered safe, there may be potential risks and benefits to consider for both you and your baby. How long does it take for hydroxyzine pamoate to start working? The onset of action for hydroxyzine pamoate can vary depending on the individual. Some individuals may start to experience relief within 30 minutes to an hour, while others may require longer for the medication to take effect. It is important to be patient and give the medication time to work. Can I stop taking hydroxyzine pamoate abruptly? It is not recommended to stop taking hydroxyzine pamoate abruptly, as this can lead to withdrawal symptoms. If you wish to discontinue the medication, it is important to discuss it with your healthcare provider, who can help you gradually reduce the dosage to minimize potential withdrawal effects. Conclusion and final thoughts. Hydroxyzine pamoate is a commonly prescribed medication for managing anxiety and itching caused by various conditions. It can provide relief from symptoms such as anxiety, itching, and hives, helping individuals to lead a more comfortable and balanced life. Understanding the typical uses, recommended dosage, potential side effects, and user experiences of hydroxyzine pamoate is essential for making informed decisions about your treatment. By following the guidance of your healthcare provider and monitoring your response to the medication, you can effectively manage your symptoms and improve your overall well-being. If you have any concerns or questions about hydroxyzine pamoate, it is important to reach out to your healthcare provider for clarification and guidance. They can provide personalized advice based on your specific needs and help you navigate the treatment process successfully. Remember, hydroxyzine pamoate can be a valuable tool in managing your anxiety or itching, but it is only one part of a comprehensive treatment plan. It is important to incorporate other self-care strategies, such as stress management, healthy lifestyle choices, and proper skincare, to optimize your overall well-being.